Okay, I think that we can start with our event. So welcome to all. Thank you very much for joining. I'm Domenico Vito, the co-chair of the International One Health Conference. And today we are here to talk about integral ecology and One Health. We are in Geneva, but in the same time, in these days, has been a great event for the One Health communities. It's happened the One Health Summit in Lyon, where we will talk about later. And this event is inside the framework of the One Health Summit, inside the One Health Festival, properly to foster and increase the momentum towards this important concept. Before going ahead, I will be very pleased to start this session with a welcome remark of a very important person for this process. And I will be very glad to give the floor to Dr. Maria Neira, former director of the Climate Change and Health Unit at WHO, that will open the session with her remarks. Maria, it's a pleasure and an honor to have you here with us, and the floor is yours.
Grazie mille, Domenico, and so nice to see you all. It's such a pleasure to see people mobilize and not only celebrating the World Health Day, but the One Health in Lyon during the last days, and the fact that the times are not the most stimulating ones. I mean, the geopolitical situation is the one that will require that we are more active, more influential, more scientifically, using scientifically evidence, and using our voice as health professionals to push for more action on climate change and making sure that our health will be protected. I was just a few minutes ago participating at the National Academy of Medicine in the States, and listening with a lot of preoccupation by health professionals who are they seeing denial and skepticism and using arguments that are against what we have been talking about for a long time, how a climate crisis is a health crisis, and most importantly, how climate action can be the best public health strategy we can put in place. So my message to you for this very good event today, and thank you very much for inviting me, and congratulations to the organizers, for Jordi and others for convincing me to be with you, is that our voice has to be very strong. We cannot just talk as health as a co-benefit of climate action, but health has to be the argument for more climate action. We need to remind everyone that whenever they take decisions on, or they are negotiating on the percentage of the reduction of greenhouse gases emissions, they are as well negotiating with our health. So therefore, we need more than ever to use our health voice as health professionals. Whatever the profession you are doing, you are a health professional, and we need to raise our voice and use it as a very powerful tool, because otherwise the consequences will be very negative. But let's be positive. If we are using the health arguments, we can convince people to do the three transitions that are so important. The transition to the renewable sources of energy that will reduce the 7 million deaths that are caused every year by air pollution, transition to healthy urban design or development in our cities, and transition to more sustainable food system. If we do these three things, not only we are fighting climate change and air pollution, we are promoting healthy cities and sustainable urban environments, we are having better diets, we are preventing many deaths, and we are promoting a good economic development, and of course, we are protecting our health. So thank you, and please have a lot of successes, because those are needed more than ever. Thank you so much, and back to you, Domenico. Thank you.
Thank you, Maria. It's always an honor to hear your words, and thank you for also the inspiring words that need to guide us towards this endeavor. for fostering and acting towards the One Health. As for the World Earth Day, as you mentioned, in Lyon we are doing, and also today we are gonna get eco. We are trying to do our best, and for sure, one of our great efforts is the International One Health Conference, which I'm co-chair, but I'm not alone. And the conference is co-chair also with Professor Margherita Ferrante from the University of Catania, that I'm very pleased to greet and to give the floor. Margherita, I don't know if you can open your camera, and I want to give the floor for you to give some remarks, and also a little bit of the history of the conference that was born properly in Catania. The first edition was held and hosted by the University of Catania for the Department of Hygiene, and Professor Margherita Ferrante was at the forefront for giving rise to this process and so on. Margherita, I don't know if you can have the floor, and back to you.
Thank you, Domenico. Thank you very much. And this is a very great opportunity to present our group, One Health International Conference. We have made many conferences until now from 2021 in different countries in Europe, and the next conference will be in Tunisia and to Sousse University, and our best topics is One Health in integral ecology vision. Is an holistic approach to ecology, emphasizing the human and social dimension and the interconnection of life on Earth, and studying the relationship between living organisms and ecosystem in which they develop. The concept was adopted by Pope Francis in his encyclical Laudato Si from 2015, and the approach is important because many fields of research and development of practices and case studies are influenced by this vision. The vision is born by the One Health approach in planetary health vision, and so this is our interest that shift from the individualist and consumer-driven culture to the one vision that prioritizes the common goods, those including to combat, to fight poverty, restoring the dignity to marginalized, and to have pay attention to the geopolitical crisis that at this moment in all the world are present, and to preserve the marginalized communities and protecting the environment by the crisis, the economic crisis, and also the energy crisis that is very incumbent on all around the world. So I hope that our common interest strengthen our possibility to fight climate change, to fight the difference by the people, and also to restore the peace in the world. That is, this moment is very important. So you are all welcomed in our group, working group, and also we will expect you in Tunisia, in Sousse, from the 5th One Health International Conference. Thank you very much.
Thank you, Margherita, and thank you for sharing this journey that now, as you said, has come to the 5th edition. And I will very briefly talk a little bit about the conference. And so Okay. Okay, so the vision and the mission of the conference is to bring health as a key aspect of our modern society, and to connect, as for the One Health approach, human health with ecosystem health and also animal health. We are doing with dialogue, and especially scientific dialogue, that since 2021 is fostering this momentum toward the One Health framework. As Margherita has said, our key distinctive active is properly to connect with integral ecology. This concept that was raised by the encyclic Laudato Si of Pope Francis, that we can summarize in one word. If we are taking care of nature, of the planet, of course, nature and the creation will take care of us. This simple concept can really enclose also the One Health vision, where the human health, ecosystem health, and animal health are interconnected in a multifaceted way. So we are fostering scientific discussion over it, and in fact, we link our talk also with publication and special issues. This is one of the last release that we had, that is a special issue on integral ecology and in One Health vision at the Springer Nature Volume 1 Health Advanced. And also we are fostering with events like the one that we are doing, the community of One Health professional and experts. These are some events that we did in the previous edition. We participate to the Mediterranean Week in Turkey. We participate with the Global Pandemic Network, and all different events that you can also see on our website. Additionally, we are working also to engage the private sector. Today I was properly in a work affairs session that was engaging also the business opportunity, but we are try to contaminate with an ethical code. Everyone that is collaborating with us is gonna following an ethical code that is properly working with the One Health concept. As well, I didn't mention before, our activity is not just scientific. We are trying to fostering also and bridging the gap towards publication, scientific and academic work, and policy making. Every year we are trying to release a policy paper that we are presenting into the conference of parties and other venues, also to decision makers, stakeholders that are more on the governance side, and so on. As Margherita was saying, next edition of the One Health conference, that is the 5th, will be in Tunisia. Today will be also the chance to launch the call for abstract that soon will be ready on our website. And the call for abstract today, this year, has a special focus on the vision of polycrises. And the next speaker will go a little bit on the concept. The polycrisis is the vision that we have multiple crises running together that, of course, are, you can say, have also health implication. The climate crisis, of course, the biodiversity loss crisis, the pollution crisis, but as well the land degradation crisis. So this vision that is taken from a very important scientific report, that is the GEO7 report, from UNEP. Now the next speaker will go a little bit around, will guide us as a framework for collecting contribution and the proposition for the 5th One Health conference that will be in Sousse, Tunisia, from October 28 to October 30. I will just close here with the contacts, and of course here a little bit of our great and nice communities. Some of the colleagues are also connected now online, and I will give the floor later. But first of all, I will be pleased to give the floor to the speakers of the first part of this session. This session is divided in two parts. The first part addressing the polycrisis concept, and the second part some example and solution of experiences and case studies for addressing the polycrisis. But as I say, let's set the scene, and I'm honored and pleased to give the floor to Professor Cristina Tirado. that has been one of the leading author of the GO7 report. Christina, I don't know if you are there. Yeah.
Yes, I am here.
Yeah, thank you very much for being with us. And it's an honor and a pleasure to have Christina that also really this year is contributing to the scientific committee of the International One Health Conference. And Christina, I give you the floor to introduce the polycrisis framework.
Yeah, thank you so much for the introduction and for making us part of this. I just wanted to check if I am sharing the screen with you.
Yes, perfect. We are sharing. We can see the
very
screen.
good. So let me go back. And the idea that you have introduced about the integrated ecology and integral ecology was something that captured our eye when we were working together in the context of the environmental polycrisis of climate change, biodiversity loss, pollution, and land degradation. And this was something that really resonated when preparing this. And let me see if I can link it with some work that has been done for the last 4-5 years by the GO7, in which they have been assessing the linkages in between the environmental crisis of climate change, biodiversity loss, land degradation, and pollution, which the conclusion was that were undermining human health and well-being and causing economic and social damage. So we have among the speakers, we have the pleasure to have the acting head of the report during the time that was done. He was fantastic, and he will explain more about the report, but I just wanted to mention that this has been the most comprehensive scientific assessment that has been done up to now. And I was first doing the assessments in the last assessment, IPCC assessment report and the IPBES, and this one really put all the dots together. So Ignacio will cover that immediately. So this was the work of many people, more than 230 experts from 82 countries, and it was really a fantastic journey to work with all of them. So the idea of how the GO7 was looking at the crisis was looking at the interconnections of them. Usually, we have been looking at One Health components in a very, in my opinion, static way, and not looking at the influences of perhaps one crisis, but not 4 of them. In this case, when looking at all of them together, the picture is totally different and is more urgent to take solutions that Ignacio will again explain later, but they will be all based on transformative approaches. So basically, for example, the typical approach that we have been looking in the IPCC, for example, that was looking only at climate change, was looking into the impacts of climate change in different climate hazards in different outcomes. And for example, in the case of the food systems or agri-food systems, on the emerging food safety issues, but also on emerging animal and plant diseases. So there are many outcomes that we could be talking about, but it will take forever. But some of the ones that are more relevant and prominent and visible for different disciplines is, for example, the impacts on antimicrobial resistance, because this requires collaboration and through the impacts as well to make this to happen. Not only temperature, but other factors that involve animal health and human health and plant health. So in the case of the components of One Health, the more disaggregated that we have the elements, the easier will be to be operational and to develop operational ways of working with legislative frameworks, etc. Many times, working at the country level, the different ministries, they talk about One Health as it was just an approach, but not something tangible. So the important thing is that to make clear which elements of One Health we are dealing with, and then establish this revising and updating the different laws, animal health law, all the food safety law, the plant health laws, environmental health laws that could be addressing not only pollutants. I mean, this one is huge. So the area of environmental health is the one that needs to be usually more disaggregated. In the case of looking at the impacts of the global environmental crisis into the different components of the SDG 3, we can see, and this was from the IPCC, the results from the IPCC, that the climate has been giving and adding more than 250,000 additional deaths per year, and this is between 2030 and 2050. Those are predictions, but what we can see that probably is the most striking result is that pollution is air pollution and indoor pollution is responsible for about 9 million of deaths, premature deaths, each year globally. So these are very high levels, but if we look at the biodiversity, there are areas where we have even 75% of the emerging infectious diseases can be zoonotic, and they often arise where ecosystems are disrupted. Another data that is not here, but is related to the invasive species, is that we cannot forget when we look into the triad or the graph that I was showing before, we cannot leave plant health like if it was not existing. Plant health is critical, and it has to be a component of One Health, independently of what we are looking into environmental health, because all the invasive species, vegetables and animal, are really like changing totally the landscape and degrading, contributing to degradation of land in arid and semi-arid lands. Same thing, the land, the degradation of land can affect up to 3.2 billion of people that are going to be affected by food insecurity, by dust storms, water stress, and weaker access to care practices for children, etc. So I think that I am going above my time, but just to mention that is the data of looking at independent stressors and crises versus looking at them as a multi-dimensional system. Like, for example, this is the result of the INFER, some of models that have been developed by WFP and SCAP in Asia and the Pacific. We can see that always the impact of the multiple risks, unfortunately, they are affecting the most vulnerable, from small farmers, women and girls, children under 5, households with low income, always the informal sectors, and definitely refugees. There is a lot of this in the Geo 7, and it's worth to read, from page 1 to the last one, but also to consider to use it for academic purposes. So I think that I have mentioned already that these issues are not only economic development and about security, but they have a very serious moral and ethical issues because they are affecting to the most vulnerable groups. So let me see. Okay, so in this map, this map is from the planetary crisis chapeau from the Geo 7, and here we put together the 4 overlapping crises. And when we were looking this versus the areas where there are indigenous groups, they were basically clearly overlapping. So the indigenous people's land rights will be critical to enable access and management to climate finance, to protect forests and their food systems and traditional diets. And we have to see that, to consider that over 20% of the carbon stored in tropical forests lies within indigenous territories, and they have been custodians of over a quarter of the world's land surface and 40% of the land protected areas and ecologically intact landscapes. So one aspect that we have been looking in the planetary crisis chapeau, and it was very interesting to see all these scientists that really are into the physical aspects of the crisis, looking and giving the due importance to the conceptualization of the indigenous peoples on planet health in a way to try to recover the crisis, and because at the end the idea of indigenous groups, and if we look at what has been happening with humans and nature, is that the 4 crises are the result of a single crisis, that is a crisis of human and nature relationships. So this is something that could be addressed looking at the indigenous vision or worldviews of planetary health, or One Health, or the health of La Madre Tierra, or different ways different ways of expressing the same thing, but looking at the importance of having this interconnectedness between the planet, the Mother Earth, nature, and people. So this is something that has been very relevant, and after has been in different chapters in the report, has been elaborated more in depth. But if you look at the critical components to make this to happen, self-determination and what I was mentioning before, land tenure rights, are critical for people's and planet's health. And this access to healing sites and medicinal plants, ceremonial plants, rituals, and in general to make sure that there is an intergenerational justice and transfer of of knowledge. So I leave it here, and yeah, thank you so much, and it will be great that Ignacio Sanchez, who has been like the strategic thinker of all these reports, give us the perspective, the actual perspective of the G07.
Thank you very much, Cristina. Before giving the floor to Ignacio Sanchez, that, as Cristina was mentioning, is action head at G7, Office of Science of UNEP. I want really to thank for also this connection with the last slide. It's very important in my opinion. We are just coming from COP30, where we also were present, and there was indigenous people participation. And one thing that was always reiterated, I say in Spanish because it's rendered in the concept, is la pego con la tierra. So this like interconnection that you render very well. So thank you very much, Cristina, for presentation and for all the effort for rendering this polycrisis. I leave the floor to Ignacio Sanchez, and thank you very much for being with us. It's an honor and a pleasure to have you here, Ignacio. So the floor is yours.
Thank you, Domenico, and good afternoon, everybody. Greetings from Nairobi, where we have our headquarters in UNEP. Allow me just to share my screen. Let me see. I think you can. No, soon you can see it. Let me say share. So as well as Cristina and you said, I had the pleasure to be coordinating the development of the global environment outlook, the 7th edition. Maybe I will basically talk a bit more on the continuation from the global environmental crisis, how Geo talked to the solutions also. But before that, just very quickly, if I can just say, in case that you don't know, the global environment outlook is a UNEP flagship report. Is mandated by member states. Since the 1995, we have done now 7th editions, and it's an integrated environmental assessment. That means that we don't look at just climate change or biodiversity, but really into the connection on how these crises are affecting the planet and also the human health. This same methodology has been used at the regional, national, and local level. So with this type of methodology, of geo methodology, there are more than 200 reports. Well, this already Maria Cristina presented on this slide, and in the connection of the crisis. I just wanted to re-emphasize here one strong message from the G07, that this global environmental crisis, they are not anymore, they cannot be seen anymore as just environmental issues, because they are also economic, development, governance, security, social, moral, and ethical issues. So we really need to act on them very urgently, because G07 conclude that most of the internationally agreed environmental and social goals are not going to be met. Here already, Maria Cristina was already also presenting some of the impacts here, so I will not stop. I will just reiterate that well, Geo7 has produced some original modeling, and the business as usual scenario. It's very clear that if we continue with the trends, the future is going to be dramatically worse, and it will really affect economically and socially humanity. But at the same time, also the Geo produce some transformation scenarios, and actually the picture of these scenarios is quite optimistic. But definitely this will require unprecedented, integrated, and very rapid transformation of some systems. What we call it also that they are interconnected systems. At the same time that these crises are interconnected, also the human systems that are creating the crisis, they are also interconnected and they need to be addressed together. So GEO7 proposed the transformation of the economic and finance system, the materials and waste system, the energy and food system, and also to better manage the environment system so it can still provide the environmental services that provides, and also how to support a better health for human. That will require a mix of technological, behavioral, and governance changes. And here, one of the strongest messages also in this part of the GEO is that this will require a whole of government and whole of society approach, which is very similar to what One Health also proposed. As we said, this is not just environmental issues, so this will require whole government. So we will require ministries of health, ministries of agriculture, ministries of finance or economy to work together and to really have a common plan on how to address these issues. And also it will also require a whole of society approach where academia, but also private sector, civil society, they all need to be involved. As I was saying, this system transformation it will require the transformation of different systems, and here the key message is that if you can see, GEO7 conclude that economic and finance system is in the middle of this diagram, because the transformation of the current economic system and the way we are financing our societies needs to change. This is at the core of the crisis. The way that we are developing is unsustainable. It's supporting an unsustainable consumption and production system. So that will be a prerequisite, changing our economy and finance and also integrating or transitioning into a circular economy, that it will be an enabler also for how we are transforming the food, the energy, and the material system. GEO7 also brings some methodology chapters where present certain levers of transformation, and also some steps and principles for this transformation, and also how to accelerate this transformation. And here I just want to say, I will not go through all these numbers, but as I said, the future, it can be quite optimistic if we really make this transformation happen very quickly. And here I would just say that one of the strongest messages is that, which is kind of obvious, but it's important to say it, is that the cost of inaction the cost of action is less than the cost of inaction. The scenarios that GEO7 presents look at 2050 as the year where some of the initial investment will start paying off. And by 2070, that would generate around 20 trillion of economic benefit per year, and it could even go to 100 trillion by the end of the century. Here, just some numbers that again are resonating also with this lens of One Health. When we are transforming these systems, it's not just an environmental benefit, but it's also a health and an economic benefit. It could reduce the number of premature deaths. It could take out of undernourishment 200 million people. It could also bring access to safe water to 300 million people, and so on. So the benefits are numerous of this coherent and systemic transformation. And just to finalize here, and I'm not going to go into each of them, but just to give you a bit of a general picture, what Geo7 then has done with these 280 experts is to go into each of these systems and propose solution pathways. The solution pathways is a sequence of actions where they also identified the levers and the actors that need to be involved. Because the importance of having this coherent approach, when the authors they were designing these solution pathways, they were also looking into each of the systems to avoid trade-offs and to maximize the synergies. Because again, like if we are promoting a transition to scale up renewable energies and low carbon energy, that has implications on the requirement on materials, and it will have also implications on land access that it could be used for food and so on. So all these connections between the systems, or many of these connections between the systems, were looked by the authors. When we are talking about transforming the economic and finance system, we talked about going beyond GDP and internalizing the environmental and social cost. When we talk about material and waste, of course, we look at going into a circular economy. Energy, we talked about solutions to have a universal and just access to energy, and fossil fuel, phasing out fossil fuel subsidies and investments. With food, we talked about a shift to healthy and sustainable diets, but also to reduce food loss. And all that, as I said, requires a better management of the environment, promoting nature-based solutions and a better also capitalizing the indigenous knowledge, as Maria Cristina was saying. So again, this slide is trying to summarize 5 full chapters in the Geo7. So there is a lot of information in these chapters, and I would invite you to go through them, and let's stay in touch, and happy to connect. You can access from here the main report and the different resources that we have in the report, and I will be happy to keep engaged and if you have any questions. Thank you very much.
Thank you. Thank you very much, Ignacio, and congratulations. I think it's very important, your presentation in our framework, probably because we were talking to take action and to understand that the crises are not just crises, but transformative crises that need to bring a solution, as you mentioned. I think it's a key message, and really thank you very much for bringing this message to our venue. And of course, let's stay in touch. We'll be very pleased if we can connect, and also you can be present in our conference in Tunisia at the end of October. Will be a nice opportunity. For sure, your presentation will inspire our call for abstract, because it gives us a lot of food for thought. But just to settle the scene, I want to now share a brief video of an ecosystem that it's in crisis, that will be also the ecosystem where the next conference will be settled, that is, you can say, the desert. So just allow me to share the screen about this video that is showing the crisis, but also some possible solution about greening the Sahel. So it's harsh, it's dry, it's hot. Okay, let me start. So,
It's harsh, it's dry, it's hot, and it's home to over 80 million people. This is the Sahel, a vast region of Africa between the Sahara Desert and tropical savannas. And at its heart are 5 countries: Niger, Mali, Chad, Sahel is one of the parts of the world most impacted by climate change. For farmers and herders living in the Sahel, their land and livestock are how they earn a living and feed their families. Healthy ecosystems and access to water are key for both. But the land no longer absorbs and stores water the way it should. Rain patterns have changed, and more frequent droughts and together with the government and people of the Sahel, the World Food Future, by helping communities, particularly women, restore their and incomes go up already, but we need to do more. Expanding our work with communities to bring degraded land back to life and store rainfall to grow crops and fodder for animals. Up from the ground with solar-powered boreholes and wells. Greening the Sahel also helps our environment. Absorb up to 6 metric. People are growing crops and grazing their animals. With new sources of income, restoring hope by addressing the root causes of hunger, inequality, and conflicts. These are some examples of life-changing activities WFP is facilitating in the Sahel, thanks to the support of our generous donors. The World Food Programme cannot do it alone. Only if we join hands, we can be successful. This is our chance to shape a better future for the people living in the Sahel.
Okay, can you hear me now? See, yes. So this was an example of a program, of the World Food Program, that was also partnering our last conference in Rome. And this has been also the chance for open to the second part of our panel. We now frame a little bit the context, and we also understand the importance to have like a transformative approach. So just to not stick on the crisis, but also to think about a solution. No? Disease resilience was saying the video. And let's start then the panel discussion of the second part of our event with Bongwa Fangwakai, that has been also a lead author of the G7, but on the topic of circularity, because the approach also on circularity can be like a vision towards some solution. So, Bongwa, it's a pleasure and an honor to have you here. Thank you very much really for joining our discussion, and I will give the floor properly to approach this important topic of the circularity.
Okay, thank you, Domenico, and hello, everyone. Good afternoon from my end. Greetings from Lagos, Nigeria, where I'm based. In terms of my daily work, I am program coordinator to the African Circular Economy Alliance, which is a coalition of governments championing Africa's transition to a circular economy. And thanks to Christina for the invitation to participate in this panel. And also good to see Ignacio. I think both of them did a very good job on describing the polycrises that we face and also highlighting the reports. I think Ignacio stopped at a very good place that I come in with the solution pathway of circularity that was part of the report. As they both mentioned, there were different solution pathways that were highlighted to this polycrisis that we face. And one of those solution pathways is that of circular economy, which I was part of the lead authors for that. I wasn't going to share my screen or share any slides, but maybe following up in the queue that they did, I will just share a presentation. And I hope you can all see my slide.
Yes.
Okay, yeah, so speaking to the circular economy, it's really a system that promotes the extension of the life of resources, eliminating waste and pollution, but then also trying to maximize value that products bring. And so it promotes the economy of sharing, or economy of trying to reuse, repair products, recycle products, rather than having them as waste. So, simply put, that is what the circular economy is. And that was one of the solution pathways that was really, it's really crossing, as Ignacio mentioned, across food systems, across energy systems, across material use, and anchors on the use of finances and the economics too as well. So it's really, really an important and a good holistic way to think of solutions that will be beneficial to, I think Christina mentioned the environmental health, plant health, animal health, and all other areas that are relevant to health. And the first speaker mentioned that we all have a responsibility towards the health of systems and the health of humans. And I think I really agree. But before I mention some of the core actions that were part of this solution pathways, just a picture of systems. I think the last video that we watched was very useful in looking at the Sahel. But this is my city, Lagos, where I live in, and we can see the effect of misuse of resources. What could be beautiful coastlines have turned into a menace that then have impacts on the health of individuals and the health of the systems of the city as well. And this is a picture from an electronics dumpster in Ghana. We can see how waste is being managed in very crude ways without any protective gear. And so there's really a call for a rethink our systems shifts as to how products are being used, products are being produced, and how eventually they are being managed when they get to the end of life, which is where the circular economy comes in. And so we had 5 core solution pathways within the circular economy chapter for the GEO. And the first one really was a call to design out waste and designing circularity. That's really embed circular economy principles in the design of products and systems and business models so that, resources are being, the value of resources are being retained and pollution is really minimized. And in terms of some of the core actions, we tried as much as possible to ensure that these actions were really specific so that the right stakeholders can then work. And then we also had a case where we had to do the mapping of the actors or the stakeholders that will work on these actions. But it's really important that we have very concise standards for products so that to ensure durability, repairability, and cyclability of these products. And for us within the African continent, we're taking it a step forward to ensure that when these standards are in place, they're also harmonized amongst countries so that there's cross-border trade of the secondary materials as well as the finished circular economy products, which I think we'll see when we come to the action that has to do with trade. There's also a call to action to address legacy pollution and really minimize the dumping of waste, like in the picture I showed, so that there's also targeted strategies for the use of this products instead of letting them become waste. And one key policy that we're seeing come up really relevant and in line with the recommendation from the report is the adoption of extended producer responsibilities, where the product producers really become responsible for the end of life of their products. That way, they're incentivized to ensure that the products stay in use longer than they normally would make it for profits. And then one core action again is in terms of promoting industrial symbiosis amongst products, amongst different institutions and businesses, so that, I mean, where my waste becomes a resource for another person's business. So that's really where we promote industrial symbiosis. So these are some of the core actions. We have additional actions when you look into the report, but these are the ones we highlight for just sharing with the public. The second solution pathways on the circularity has to do with how markets are being created for goods and services, ensuring that the circular economy is being considered, that the market is transparent and it's also efficient, so that these principles are really taken into consideration. Some of the core actions is to ensure the use of digital technologies like blockchain, so that there's good transparency and traceability of some of these products, because some of them, when they go into the market, you cannot really trace them to either retrieve them or ensure that they are being managed effectively. There's also the need to reform taxes so that circular products are being incentivized, and then there's also the discouragement of the use of linear products. So that's where taxes come in, where you levy higher taxes on linear products more than circular products. And a point that is really relevant to us on the African continent is with respect to SMEs and the informal sector. And you recall the picture I shared on the e-waste handling in Africa. I mean, there's really a need for capacity building of these SMEs and informal participants, so that, I mean, they're able to use effective methodologies in their businesses, and and as well be able to trickle finances in, so that they're able to effectively scale up. And then one other point has to do with how the transition is just, because it's one of the core reasons that the circular economy tries to address is in terms of just transition, where there's consideration for vulnerable people, for women, for youth, and there's both legal and financial support that is given to them. So that's where support for fair and effective markets for circular goods and services comes to play. The third solution pathway is in terms of how the financial systems are being reformed, so that the right investments are being channeled for circular models and businesses, so that the societies are able to shift from linear to circular economies. And one important action here is for the capacity of financial institutions to be built appropriately. So we engage a lot with financial institutions, the banks, commercial banks and the likes. And I mean, they always say they have products for circular businesses, but you realize that either the products have very high interest rates and unrealistic collaterals that the businesses are unable to get access to. So that becomes an issue. So it's to really build capacity of this financial institution so that they can be able to effectively evaluate and fund circular businesses, which in turn will also lead to being able to have nature-related considerations in their financials, because at the end of the day, it's about profits margins for some of these businesses. So when they're educated to understand that sometimes it goes beyond profits, but also the impact they're able to make in society at large, then they understand that. Also to prioritize projects that are being channeled into international development financial institutions, especially in low and middle income countries. Within the African Development Bank, we're seeing more and more circular economy products, projects and programs being considered. I mean, compared to 6 years ago, where even the concept of circular economy was not known. So there's some traction there, but there's more that needs to be done. And then the issue of matrix for measurement, uniformity in matrix, it's really a core area that has to be considered. And like I said, ensure that the funding for circular economy, it's been considered. And there's also a call for a global circular economy fund to be set up. And we, as the Alliance, the African Circular Economy Alliance, are fully backing the initiative to set up a fund for circular economy. The fourth solution pathway has to do with the trade systems. I think when I was trying to speak to the issue of standards, on the first point, I mentioned also harmonization of standards. And I mean, one of the core reasons for this is to ensure that there's easy passage of goods and services across borders, circular goods and services across borders. There's proper guidelines that are being created for these goods and services so that the customs are able to really understand and be able to have passage of ways. And one of the core reasons is for the scale up of these markets for the circular economy, because when you restrict them to a certain area or country, then it's not able to scale up effectively. So when you have this fair and transparent trade systems, the market access becomes easy, and you're able to have the easy transmission of goods and circular goods and services across borders. There's also the bit on subsidies so that the activities of the extractive sectors are really contained. There's the case of international agreements that are needed to tackle the illegal waste trade and then promote effective transboundary movement of secondary materials and resources that I mentioned. So this is in terms of the point that has to do with pushing for effective trade systems for circular economy. Sorry, because of time, I seem to be rushing so fast. And then the last point has to do with promoting circularity as a societal goal. And for me, this is a very special point, mainly because this was one of the areas I worked on in the chapter, but then also because when you look at the educational system, that's where a lot of the learning happens. So the first point is on integrating circular economy principles into education at all levels. So when you think primary, secondary, tertiary institutions, there's a need for circular economy to be taught, not as a standalone subject or a course, but really integrated into the principles that are being taught, because the linear economy is what most of us grew up learning about, and that has formed the foundation of the business world on how things are being done. So when the circular economy is really promoted in educational systems, you'll find out that young children from primary schools have or already thinking circular economy from that early stage. Then there's also the implementation of regulatory measures so that linear products are being phased out. And these regulatory measures include also guidelines on advertisements, on how communication is being propagated around the circular economy, which also touches on the point on raising awareness of circular lifestyles, incentivizing choices that people make. So awards for businesses, awards for scholars that are really integrating circular economy in their daily lifestyle, in their businesses and all. That's one way to promote this kind of lifestyles. And then the last point here is on creating convenient models for product repair, reuse, sharing, and take back, ensuring that the facilities are really available and within easy access so that people are able to easily lean into this circular economy principles. So I hope that I've kept the time and I've been able to share on some of the solution pathways and actions that we have highlighted for circularity as one of the solutions for the polycrisis that was being presented. Thank you very much.
Thank you very much, Bonwa, for this very complete presentation. It just came into my mind today here into the venue of the One Health Summit. There was a question inside like a round table, how to make One Health favorable for businesses and so on. And I think this vision also circularity can really help on responding to this question, but we will go faster into that. Now let's go to the next speaker. That is Nidhi Nagabatia from the UN University, the Peace Unit, that will talk about another transformation that can be arised, that is about the food system, also including the local knowledge. So Nidhi, the floor is yours.
Thank you so much, Domenico. And once again, I'm very delighted to share some insights from our work at United Nations University office in Belgium, and also the work that we have presented and supported in various high-level political forums, including climate COPs, along with our partner, Domenico. And maybe I'll also share a couple of slides as I am going to just give you an overview of food system transformation through bridging different knowledge systems as a solution pathway. And this has already been alluded to by the speakers that spoke ahead of me in terms of language like synergies, policy, coherence for development. And when I was reading the conference note, it was very nice to see that environmental health has been added as a part of an overarching polycrisis or the planetary health crisis that is being discussed in the terms of the Rio Conventions, but also other multilateral environmental agenda, the pollution crisis, the biodiversity loss crisis, and the climate change crisis. And directly and indirectly, it all contributes to the human and the human health, the livestock health, and the environmental health in general. So having said that, I will also walk you through some of the different knowledge systems discussions that we have had in multiple forums, and one that Domenico also contributed to on the Action for Food session at Belém, and wherein we discussed about more or less with a focus on the Malabo Declaration of Africa as an example to understand how national and regional level commitments are facilitating or the food transformation agenda at the regional level, and also contributing to the Sustainable Development Goal, specifically for SDG 2. Why this is important in the context of large emerging challenges that are being discussed more widely, like the climate change, adaptation, and resilience building. This is because the SDG reporting system now still shows very concerning numbers, and this whole solutions pathway have to be discussed with the lens of nexus, that is the interconnectedness that has also been reflected by the previous panelist. Here in this session, we also looked at how this is not just about creating new policies or new institutions, but taking a deep dive in understanding the structure, the functions, and the effectiveness of existing policies and institutions, so that we don't have to reinvent the wheel, but we are able to refine and reform existing structures and policies and institutions to contribute to the implementation of SDGs 2 in tandem with other SDGs, but also to take account of gaps and needs in setting the post-2030 agenda. That's point number one. The other point that I like to also share from our discussion is that bridging knowledge systems is one such solution. Yeah, I would say a mindset, rather a pathway, or a pathway alongside the mindset, because we have to again reiterate our focus on understanding the connections and mutual learning between global north and global south, learning between different regions of the same geography, or even at scale, granular scale, like cities to city learning or community to community learning. I think to solve the complex problems we are discussing in the big spectrum of environmental governance, validating diverse resources becomes even more relevant. And I think a respectful dialogue with local knowledge holders, indigenous knowledge holders, is something that we also discuss widely. And in that discussion in the Food Hub in Belém, we also had several participants that represented indigenous voices. I think we also want to iterate that knowledge co-production, integration, and cross-fertilization, these are the key solution-oriented thinking that remains vital if we have to envision food transformation system that incorporates local and traditional knowledge, that respects indigenous way of thinking, and takes care about setting an agenda that is holistic and just not restricted to ticking the boxes. As if you see some of the quantitative and qualitative indicators currently listed in monitoring SDG 2, they are quite off track because of other geopolitical conflicts. So also focus on externalities that were not necessarily a part of the discourse on food transformation, but food transformation is directly and indirectly influenced, affected negatively, most likely by geopolitical volatility. So that's another point I like to make, to understand the connectedness between larger geopolitical processes and food transformation in research, in policy, and capacity building, and thus also in education. I think some of the core concepts that we can borrow, and we really don't have to go far. If we look around us, we see that local people, native populations are knowledge holders of very simple yet very applicable knowledge systems, and that co-production pathway will help us in the term that I'm borrowing is braiding, that is weaving different knowledge and value systems, to whether it's indigenous knowledge, Western knowledge, to design and understand policy solutions and identify policy priorities for a more stronger and impactful whole. The integration and coexistence has been also discussed in different formats by the speakers on the screen, and different interventions that are made in this session. However, if we are able to also understand the cross-operationalization or cross-fertilization, allowing them to exist in parallel for mutual benefit, we have to again look for different commitments that is made across jurisdictions. And by jurisdictions, I mean that if we are looking for integrated solutions, we need to bring different actors and agencies on the same table. And that's where a lot of homework goes in how to do that. It's much more easier in some contexts and countries and rather challenging in the other. And from a research perspective, we at the UNU system, we try to decode transdisciplinarity, which is also very pluralistic or has multiple meanings for multiple stakeholders. And approaches like nature-based solutions at least is giving us that pathway, whether in food systems, whether in urban planning, that we have that overarching umbrella language that we can apply in designing those solutions. So again, emphasizing on standard pathways that are appearing in environmental governance related documentation, whether it is Paris Agreement, whether it is Sustainable Development Goals, or so on and so forth. So just kind of taking your attention to take note of these common threads, or like a golden thread that cuts across multiple emerging challenges and solution pathways that are being discussed. I think I'm also going to share one example of a community-oriented project with a focus on food security and indigenous knowledge in Canada, and through United Nations university system. Have been involved in this project for past 10 years, and I'm emphasizing on the tenure of the project because it took us a couple of years to even build trust with the community. And food transformation, climate resilience building, and community and participatory approaches can only be materialized if we build trust with the community. And if you see the team, we do have a very diverse team to be able to facilitate that transformation. We have anthropologists, we have climate modelers, we have soil scientists, we also have computer scientists. So also diversity of the team is super important, that we have a good balance of social scientists, human scientists, and natural scientists to be able to do that. And then we have a similar selection of community volunteers who can work in tandem with this diverse set of teams. And if you can see on the board that I've taken though I'm showing you the team, I've taken some of the local knowledge narratives that were presented to us. Multiple evidence base comes from more of contemporary knowledge or more current knowledge, which is built on the Western way of thinking. However, if we see a similar approach or philosophy coming from the local or indigenous community, they use a two-eyed seeing philosophy, which is also, you see the First Nations Mohawk word for it. And it's a concept of learning to see from one eye with the strength of indigenous knowledge and from the other eye with Western science. So sort of again, bridging the knowledge systems towards a shared goal and a shared understanding. And similar other examples also that we could harvest by the process of dialogue, by the process of participatory engagement with the communities while implementing a co-creation of indigenous water quality project and also another follow-up project on local food security. And I would like to also conclude with a focus on the WEF approach, water and energy and food approach, but environmental health, as I noted in the concept note of our conference, becomes an integral part of this addressing the polycrisis solution pathway thinking. And it's nice to see that focus on overarching environmental health alongside the sectoral goals on water, energy, and food security. So this is a new addition to the WEF thinking that has now been existing for some time. I would also like to put emphasis on the evidence generation that happens through science. However, the other key elements of facilitating any transformation, and in this case, I'm talking about food transformation or transformation towards a resilient future for all, is respect and legitimacy. While some knowledge systems can be validated through scientific validation, there are other knowledge systems through we don't have similar systems to validate, but we need to incorporate and integrate them through other dimensions of giving them respect and legitimacy in that whole integrated thinking, and specifically on local knowledge and integrated indigenous knowledge. We don't have any reference systems or peer-reviewed publications. So I think, how do we legitimize and respect that knowledge? And this happens if we are able to implement, design, and implement some of the projects. We learn a common language. And similarly, I think partnership I've already alluded to, but a shared language. So if we can create a language of respect to achieve that transformation in the food system, also in addressing other sustainable development goals, that will take us a long way in facilitating a meaningful dialogue and active participation across stakeholder groups. From a more research and academic perspective, I'd like to also close by saying that addressing philosophical and ethical dimensions remain central to transformative agendas that we are envisioning for food systems and other challenges like climate security, human security, and health security for all, including power imbalances. And I allude to that this has also been alluded by other participants and panelists in how knowledge is valued and used. I think this is all from my side. I'm again very happy to have contributed this insight into this panel. Thank you so much.
Thank you very much, Nidhi, for your presentation. Thank you also for the collaboration that we are having now since few years. I think that you connect very well also on what we were talking about the implementation also of local knowledge also as a way to reconnect with nature, and this systematization as this common and shared knowledge. I think it's very important and food for thoughts also for our next conference. Now let's turn to another crisis that we mentioned, of course, at the beginning. that is a paramount crisis. The numbers that for sure we're going to present are really interesting and so on. I will give the floor to Eleonore de Azizu from the Center of International Environmental Law, CIEL, here in Geneva, that is joining us in presence here at the International House of Association. We are talking about the problem of plastic, okay, and the solution that can be the plastic treaty. Yeah, the floor is yours.
Thank you very much, Domenico. I won't use a presentation, but I hope my points will be clear. Happy to take questions. So maybe perhaps to give a first point of remark is that the Center for International Environmental Law works a lot from a legal perspective. So also the input that I'm going to be sharing and some of the key thoughts around the topic of plastic pollution come also from that perspective more specifically. And I'm very glad also to see throughout the presentations that actually we all are looking at very similar issues from different angles, but it really resonates that we are looking into things in a systemic way. I'm referring, for example, some presenters talked about climate change, others discuss also some of the trade aspects of the crisis on pollution, climate, etc. There were also references to EPR, which is also a key component from a legal perspective to implement the polluters pay principle, and of course, thinking about what are the financial aspects and the costs of the different crises that are interlinked, being of course the human cost in terms of death, in terms of sickness, but also the planet's costs, how we are polluting our lands and making it even more difficult to grow food, and of course the economic cost, which is something that I think it's getting more and more traction and important also for policymakers to realize, because there is an economic cost of inaction from the health system as well. And I think like many economists are increasingly analyzing those elements, and I think it's key in the sense that it should not be necessarily the key reason why we act to look at the economic cost of inactions and pollution and climate crisis and biodiversity loss, but it is a language that unfortunately our politicians talk. So we need to have be able to bring information from very different perspectives in order to really touch our public when we work on these issues. So from our perspective, we work on very diverse topics, but one of the topics that we have been focusing for the last couple of years, as Domenico was referring, is the issue of plastic pollution. And here, maybe to reflect a little bit before giving some key points on this, is that what we are seeing is that pollution is continuing. Pollution is multi-phased. It's not just what we are been seeing, for example, and it's quite more now in a more public scene, which is like, for example, the pollution that we see in our oceans. It's true that since the 70s, we have documented and have gained more awareness of the pollution that we can see in our oceans, but pollution happens in many different ways and environments. It's also linked to the food that we eat, that is also polluted through the different chemicals that are made and used in order to produce plastics. And just to think about, like 99% of plastics are made of fossil fuels. So you are already, when you think about a plastic product, you have basically fossil fuel, what I prefer calling fossil resources, because it's a little bit of a language thing of, we think about fossil fuels as a question of energy, but it goes much more beyond the issue of energy to actually reframe a little bit that discourse to say it's actually a question of fossil resources. So when you have a plastic product in your hands, you're basically having in big part fossil resources condensated in a specific way. And then also, like the other chemicals that are made of, that are used in the context of plastics that also have health impacts for us as consumers. But again, like we have this multi-phased issue around pollution. And that's one of the key aspects when we started negotiating the plastics treaty a few years ago. The discussions started, as I was referring, scientists have been bringing the issue of pollution in the ocean. We have seen on TV and movies and documentaries that marine life was dying also because of the plastic pollution, but also scientists started demonstrating that there's also not just that question, but the question also of microplastics. And so in our UN setting, discussions a few years ago started with that focus, and then through research and the good work of UNEP and other institutions, we started understanding that actually pollution means much more than just the marine environment and microplastics. So the question then is, how do we define plastic pollution, and what exactly we need to do in order to end plastic pollution, which is the mandate that was given to countries to negotiate a specific treaty back into 2022. As some of you may know, we have not yet concluded a treaty. It is something that is on the works, and there are some obstacles on the way. But I think it's important, to replace a little bit this conversation ahead of some of the challenges that we're presenting. So basically, I would say that there are, in my opinion, from the work and our experience, three key remarks that can be taken from our experience working on plastics. The first one is that it's often very difficult to try to bring the knowledge of science and scientists into some of the spaces, because even if plastic is very tangible, everyone uses it in its everyday life, it's still somehow difficult to some people to conceptualize as actually plastic is a health issue. And it's a health issue, of course, for our environment, but it's also a health issue for ourselves as human beings. And, to try to bridge a little bit those conversations in order to bring science into the rooms and to really make it tangible and then bring that knowledge into specific policy making. So that's one element. The second element is that it takes time to develop the right approach. To be very honest, to negotiate a treaty in 2 years is very optimistic. We all know that geopolitics right now are particularly challenging, and also there lies some opportunities. But it takes time, in principle, to mobilize more than 190 countries to have the same vision of what needs to happen. And at the same time, it touches different interests. There are countries that also depend on oil and gas that do not want necessarily to stop producing plastics. And here, maybe one key element is that the International Energy Agency, for example, demonstrated in a report not so long ago that, and you will see next year, that by 2027, the majority of the oil and gas that would be extracted would be not to produce energy, but actually to use it as raw materials for the petrochemical industry. So that's also why I think it's important to put things into perspective and understand, that things are a little bit more complex and systematic, and not just to talk about energy and climate change, but to think about like oil and gas and coal. It touches climate change, it touches our health directly also with pollution, it touches the issue of plastics and all the different products that are made out of petrochemicals. So as I was saying, it takes time to negotiate a treaty, to find agreement, landing zones of what needs to happen. And then it also takes time to implement anything that we are trying to achieve. And even as, for me as a lawyer, even to go to the courtroom, to bring science to the courtroom and to try to make some, to have courts explicitly recognize some issues also takes time. So this is a little bit challenging in our work, but it's still ongoing. And I think on the positive end, and to conclude, and there's plenty of more things that could be said in the context of plastics. But in general, I think what I was referring before to the fact that there's more and more understanding of the different costs of inaction. There's also more and more understanding of the opportunities that lie ahead of being alternatives that could be taken in order to try to remediate plastics. And of course, here we need to think very carefully that we're not moving one problem, translating into something else and promoting it as an alternative when it's not necessarily fully, without risks. So we always need to think about how to address alternatives. But in any case, I think, like increasingly understanding that, especially also with our geopolitical situation right now, with the crisis in the Gulf, that we need to stop relying on fossil resources. We need to find alternatives. And in part, it's also about thinking about what are the ways to reduce our dependency on oil and gas and coal to produce plastics, and think about the alternatives that need to be taken there, and collectively continuing moving ahead into trying to get plastics treaty. So hopefully soon we'll see those results, and in between I wish you a good afternoon. Thank you.
Thank you very much, Eleanor, for your speech, and thank you for the work that you are doing. I know that is very complicated, and also sometimes I also teach in plastic in Mediterranean, so to my students I tell it's a process, but it's important to be there and to do not to maintain the perseverance and so on. But even from the point of view of the law, there is also the research and the academia that can support on that. And properly, with this bridge, I will give the floor to my colleague, Dr. Gabriela Fernandez, that is director of the Metabolism of Cities Living Lab at the San Diego State University, that will introduce a little bit the activity of the Metabolism of Cities Living Lab, and also an example of research in support to the plastic crisis. Dr. Fernandez, the floor is yours.
Thank you again. I think we had a great, interesting conversations. I also wanted to mention that I was also a review editor for the GEO7 as part of the UN. I was part of the interlinkages across environmental changes, scale, and geographic regions and subregions, focusing particularly in Western Europe and other sections. So the GEO7 report is now available, so I encourage you all. Thank you again to my colleague, Dr. Tirado, as well as Ignacio Sanchez for being part of GEO7, as well as Bonwa. So now I want to talk a little bit more about how we can utilize, let's say, different technologies in order to make practical applications at the local level. So I'm Dr. Gabriela Fernandez, Director of the Metabolism of Cities Living Lab at San Diego State University. We're part of the Center for Human Dynamics in the Mobile Age at San Diego State University in San Diego, California. And so what we do in our lab is particularly try to advocate for vulnerable communities, but also localizing the United Nations Sustainable Development Goals. We focus on several of the different dimensions, from social aspects of the SDGs, environmental, as well as economics. I teach master's students in big data analytics, so we try to develop different types of technologies for local governments. We also focus on developing, let's say, practical applications with students, citizen science applications. We also have several MOUs in Italy, in Colombia, in Mexico, as well as Tunisia. We've developed several different international events, as the One Health International Conference being one of them, and also different side events at COPE, but always keeping in mind the idea of technologies and how they can help vulnerable communities. The SDGs cannot be, let's say, created if we don't consider everyone, right? So going off of the leave no one behind approach, we've also worked closely on the topic of homelessness, as this is such a large issue that is happening across the US. We have over 770,000 homeless people, with more than half being in California. So we're now utilizing AI in order to track homeless encampments. For the past couple of years, we've also developed SDG tracking dashboards, identifying hotspot areas across San Diego County and different areas. We've also done this in Tijuana, Mexico, with our partners UABC. The idea is to find those different interconnective on the SDGs, how they relate to each other on the social, environmental, and economic aspects, looking at ways how different indicators could interconnect, but always the idea is to advocate for those that are being left behind. In the past, we also tried to connect with different types of people. So we tried to showcase our work through murals, developing an exhibition at San Diego State University. Feel free to take a photo and share our virtual exhibition. We're also part of the SDG SDSU sustainability ecosystem within SDSU, where different departments across campus are focusing on different areas of sustainability. So we are part of that. Additionally, we've worked closely with children. We work closely with centers that focus on people with disabilities, work on areas on microplastic, which my students will be showcasing a bit of the work that we are doing and how AI complements. We work closely developing beach cleanups, with high school students as well. This was an event that we had last year in November. The idea was to bring together high school students, community college school students, and different university students from all across San Diego County to develop innovative solutions to help on the topic of homelessness. So I want to now turn it over to my students, Sayali and Qatar, that will explain a little bit more on a practical application on the usage of AI and microplastics.
Thank you, Dr. Gabriela. Let me share my screen. Can you see it?
Yes.
Yes. Okay, so hello everyone. My name is Kauthar. I'm a PhD student working on environmental toxicology in marine ecosystems. And me and Sayali are very glad to be among you today, presenting our work entitled Advancing Marine Microplastic Detection through AI-based image segmentation. Next slide, please. So to introduce the work, we all know that microplastic pollution is a One Health crisis. It does not only affect human health, which is found in human blood, crossing biological barriers and causes inflammation and oxidative stress, but it is also found in it does also affect environmental health, where it threatens marine biodiversity and acts as a vector for pollutants and invasive species. So connecting environment, animals, and humans, it surely demands an integrated response. Why monitoring microplastic is challenging is simply because there is a huge difference between traditional methods and AI-based deep learning methods. They are both accurate, but the AI-based deep learning methods are way faster, they are scalable, and they cost way less money. Next. Our work showcases developed a deep learning segmentation model using polygon-based accuracy. It outperforms traditional methods using IOU benchmarking, and it aligns with global AI-based environmental monitoring initiatives like drones and satellites. Next. Now, there are different techniques for the detection of microplastics, like traditional techniques, for example, FTR and Raman spectroscopy. They do have high specificity, but they are labor intensive, they cost a lot of money, and they have low throughput. Also, there are the emerging thermoanalytical methods. They do give out on a chemical identification. They do have high throughput, but they are complementary to spectroscopy. But the deep learning approaches, such as MarkRCNN, UNet, or FosterRCNN, are automated segmentation, and they have a pixel-level accuracy. Next. For the artificial intelligence used in scalable detection, we also find different methods, like different techniques, used for example, for object detection framework. Like YOLO V8 or V5 and V8. They are fast, accurate, suitable for real-time and large-scale monitoring. For segmentation tools like CellPose, it's effective for complex imagery. And for the performance metrics, they are used to evaluate the detection and localization. To summarize, artificial intelligence methods enhance scalability, efficiency, and reproducibility, complementing traditional approaches. Next. So our work was mainly the collection of plastics on the coast of Sousse, Tunisia. And then after the collection of the plastics were categorized into 6 categories. And there is also a seventh category is Untitled Other, which collects the things that could be found on the beach, but there are non-plastics, like cigarette butts or shattered glass or seaweed and everything. We eventually collected 1,080 high-resolution images, and then we proceeded to the annotation process using RoboFlow, which is a polygon-based segmentation, where it captures irregular shapes better than bounding boxes. But we found some challenges, like the LDPE films were semi-transparent and wrinkled. The reflections of the PET and PS, it caused false contours, and the films were a little porous and they had irregular shapes. But all boundaries were then manually validated, which created a ground truth dataset. Next. This is the image distribution and the number of each type of plastic per image. Also for the background, and also we did not only work on each plastic individually, but we also did the mix and match of different types of plastics. Now I leave the floor to Sayali.
Thank you, Kauthar. So these are our materials and methods that we followed in order to identify and classify the microplastics. First, we take a sample image. Supposedly, here in example, you can see high-density polyethylene microplastic. And then we identify the edges of the microplastics. You can see small white lines around it. By using edge detection techniques, and then we classify HDPE by using some highly advanced computer vision models like YOLO, which classifies the microplastics with the name and the accuracy of how true is that. So there are three techniques that we followed. The first thing is the ground truth model. We drew the lines in the exterior of the microplastics so that it can be the ground truth and used as a baseline reference data set. The second tool we used, or the model we used, is Segment Anything model by Meta. It is a transformer-based segmentation model. And third one is CellPose, which is specialized in biological and irregular contours. All the models were compared against manual annotations. So we compared SAM and CellPose to the manual annotations by RoboFlow. And we use intersection over union metric for the overlap accuracy. So telling you more about Segment and Anything model, it is basically developed by Meta AI, and it works on any image domain, can segment anything, points, boxes, text prompts, etc. It has a vision transformer in it to create embeddings of the image, and then it encodes the input into a box and masks, and then decodes with combining image prompt embeddings and predicts the segmentation masks in real time. So this is the model that we worked on. You can see here, it shows HDPE microplastics that we have seen before. So this is the image you've seen. We created the masks by RoboFlow. These are the masks created by SAM model, and then we get an overlap by using IOU. You see here that there is only 70% of overlap between these two, which is a very good IOU in case of IOU metric, which is a very good standing in that case. So the red regions are actually false negatives, where the human drew a boundary, but SAM missed it. and the green regions show where SAM identified extra regions but not present in the human annotation. So we did this on each plastic type, and PET showed the maximum mean IOU per plastic, which is 0.7, 70%, followed by HDP, PP, LDP, PS, and PA. The average IOU score between the hand truth, ground, and mass, and the SAM predicted for each plastic type. And this IOU metric shows the quality of higher values indicate the better segmentation of the performance. So here we see mean IOU is doing better for PET. In similar case, this is a strip plot. We see PET is giving us high quality images and identifying a good IOU overlap between RoboFlow and SAM, followed by HDP and PP. And the red images you see, these are not identifying really well. So the IOU score is not really good between them. This is the final results, consolidated results that we got by manually annotated versus SAM. PET with 0.752, followed by HDP 0.736, and PP by 0.569. Now the cell pose, we come to the second model that we worked on. It is basically developed for biological and microscopy images, which specializes in detecting cells and particles of irregular shapes. We trained this on Cyto2 nuclei, and it works well with fluorescence phases, contrast, and bright field images. Let's see the working. So when we ran this whole thing on RoboFlow, RoboFlow identified this correctly because it is, of course, a ground truth mask. And then we ran these images with respect to cell pose, and it only identified like 5 of them. And when we get overlap, it only shows like a 63% agreement between cell pose and the ground truth mask. So we see that it really misses the particles in the original mask system. Let's see. So when we performed it on different microplastics, we see HDP is doing a lot better than PS, PA, LDP, PET, and PP. PP is doing really low, whereas HDP is like on 0.63%. But here we see SAM is performing really well as compared to the cell pose model because it is able to identify a lot of microplastics, and there is a good overlap between the ground truth and the SAM masks of different plastics. So this is the consolidated results for manually annotated versus cell pose. We see here only HDP is performing well in this method. And while we compare these two things, we see SAM is performing extremely well, and therefore our future research, and also we are currently working on it, is based on taking SAM because it's performing well, taking SAM for its precise particle segmentation and combining it with CLIP, which is a model by Microsoft, and enabling the model to focus on relevant regions and match them with microplastic categories. So we use this pipeline. We achieved an average accuracy of 94% on average. So if you just put an image clicked by in your phone in a chatbot, it will be able to identify what kind of microplastic it is. So this is why we achieved this on top of the SAM. we combine a CLIP model with it and achieve 94% of accuracy. But we are planning to expand our data set because currently it is only based in Sousse, Tunisia. We are trying to take it over the regions, over different regions, and also trying to expand our parameters for the research like brightness, texture of the plastics, illumination, these kinds of things. So thank you. I think that's all from our side. Thank you.
Thank you very much, Sayali, and congratulations to the team for the work. We have seen an example of how digital innovation can support also some of the polycrises and some of the One Health crisis. And probably on that, I want to give the floor for some remarks. For the sake of time, we will just skip the Q&A, but there will be the chance after the session to eventually connect and exchange some thoughts. I want to give the floor to Jordi Serrano Pons, that is can give also the point of view of innovation from a clinical side for a brief remark. So Jordi, thank you very much for joining the session. The floor is yours, and then we're going to conclude with Casimiro Vizzini. Jordi, the floor is yours.
Thank you very much. I'm trying to share me.
Yes,
Hello?
we can hear you. The connection is not very stable. I'll give you the sharing grants. So very quickly, please. Okay, thank you.
Yeah. Sorry about that. I think my connection has lost connectivity. I was going to share my screen, but I think it's not possible now. Well, can you hear me anyway?
Yes.
Good. So thank you. Let's see if it works in a couple of minutes. But meanwhile, so I'm Dr. Jordi Serrano. Some of you know me. So I'm leading the Planet Health Innovation Network. And basically, we are trying to foster innovation in global health, One Health, and planetary health. And it's so important to have, and I'm so grateful for this last presentation. Congratulations to all the students and to Gabriela, and it's very good that they are developing that in Tunisia, no? Where you will develop the One Health conference next autumn. And basically, I wanted to point out basically the principles of all these necessities that to really develop innovations on all these fields. Basically, I will drop on the trying to present because it's not what we launched One Planet chapter in Barcelona. Some of you attended, another in Rome, and we're planning precisely in Geneva. And basically, it's important to bring all the stakeholders together, but to foster innovation inside the hospitals, basically inside primary care doctor, and trying to implement all these innovations from the point of view of the clinicians, but also of the entrepreneurs. Some examples, many of you know the digital, so the exposome concept. So right now, with the tools that we have and the capacity of monitoring, we have the capacity to develop a digital exposome concept, for example, in which many clinicians can monitor patients at home, and also monitoring the air quality of the air in their own home. So between the digital exposome plus the air quality at home, we can really know many of the things that before we associated only to social determinants of health. Now we can really expand the concept of the exposome and really monitor all these things. And like that, many other devices and tools that can be used for these purposes. One specific example of entrepreneurship was developed by my own team. We're working in something called P8 Health, which we are fostering prevention, prediction, all these types of piece of medicine. And basically, it's important to really highlight how important to achieve a green hospital, a green primary care system. As you know, many of the hospitals and primary care systems are associated with health without harm, which is a movement born in the States, but also present in Europe and many other countries now. How important is prevention to really fit all these things together? With prevention, we postpone emissions, resources, and many other things, no? And just to finish, we've been writing a book with other colleagues about the future of hospitals, and one of the chapters, chapter 10, is about the green hospital or the primary green center, and really the necessity to really work together with the patients, citizens, to work with them in how the system can really work in prevention, how the system can really make healthcare workers aware of the different pathways that will diminish waste and all these emissions. It's so important and it's super related. So the book has been launched in the last months and it's been quite successful. And as I told you, we are planning a new chapter of Planet Health Innovation in Geneva, precisely in 1 year. So we want to invite you all, and it's always a pleasure to collaborate with Domenico, Gabriela, Professor Ferranti, these people are extraordinary, and thank you very much to all of you to keep pushing. Thank you, and sorry for the presentation.
Thank you very much. No worries, Jordi. I think that will be the chance also to have space, to give space for the book that you launched, that is important to the transformation also of the health sector, and also glad to like have the presentation here in Geneva to launch the chapter next year. Now let's go to conclude because we have a little bit out of time. We connected these events to the One Health Summit that has been in Lyon and was like a great event that full of momentum and also political, you can say, decision and statements. I give the floor to Casimiro Vizzini, that is senior health officer at the Africa Europe Foundation. So Casimiro, to you, the mandate to close the session, also connected with the Lyon event.
Thank you, and thank you, Domenico, and all the colleagues and friends still in Lyon, with several parallel events going on the One Health Festival and the G7 presidency, French presidency health working group. Let me start with a simple observation. We have heard today something that confirms what we intuitively know, but that we are often struggle to operationalize. We are no longer dealing with isolated crises, but with systems under stress. Climate change, biodiversity loss, pollution, food insecurity, antimicrobial resistance. They are not parallel challenges. They are deeply interconnected dynamics shaping the health of our societies. And this is precisely where One Health and the integral ecology converge, not as concepts, but as governance frameworks for complexity. From the Africa Europe Foundation perspective, 3 reflections stand out. First, One Health is no longer a technical agenda. It is a system agenda. We heard clearly today that solution cannot sit within ministers, sectors, or disciplines. What is at stake is they have the ability to align health, agriculture, environment, finance, connect science policy and implementation, and move from fragmented responses to system-level delivery. This is not easy, we know, but is exactly what where Africa-Europe cooperation can bring value, because across both continents we are experimenting with regional approaches to health security, with integrated surveillance systems, with new financing models of resiliency, especially in this moment of geopolitical turmoil and disengagement from aid. The question is no longer what is One Health. Now, I think, how do we make it work in practice at scale and across systems? Second point I would like to bring is the polycrisis is also a governance crisis. Several speakers highlighted this, and we do not lack knowledge. We do not lack evidence. What we lack is alignment of incentives, coherence across policies, and often the ability to translate science into decision-making under pressure. This is trust central. And trust in science, trust between institutions, and trust with citizens. And these where we can see growing the challenges globally is if we want One Health to deliver, we need to rebuild that trust through transparency first, inclusion, and accountability. I think these 3 points are very important to rebuild trust. The third point I want to underline from the Africa-Europe Foundation perspective is that Africa is not only a vulnerable region of the world, it's also a driver for solutions. Too often global discussions still frame Africa through the lens of risk. But what we see in practice is something different. We see innovation in community-based health systems, leadership in regional cooperation and public health institutions, and increasingly locally driven approaches to climate resilience and food system transformation. Africa is not just adapting, it is shaping models of resilience that are globally relevant. And this is why Africa-Europe cooperation matters. This is what I want to bring from my point of view from the Africa-Europe Foundation. Give me a few minutes. We don't need anymore this aid perspective framework, but a partnership of co-developed solutions. So where do we go from here? If I take one message from today, it is that we need to move from dialogue to delivery, and this was one of the messages often repeated during the One Health Summit here in Lyon. This means focusing on a few concrete priorities, operationalizing One Health governance across sectors and levels, aligning financing with prevention and resilience, not only response, strengthening the science policy interface, including open science and data sharing, and finally investing in people, especially in youth, as agent of transformation. Because at the end, systems do not change on their own. We need people to change the systems. Let me finally conclude with a final thought. In the fragmented and uncertain world, One Health offers something rare. It offers a way to reconnect what we have artificially separated: human health, animal health, environmental and integrity, science and policy, local knowledge and global frameworks. But this will only work if we are ready to act collectively and to take responsibility across boundaries. The One Health Festival and moments like today are important because they create the space for alignment, but the real test starts tomorrow. Can we turn this shared understanding into shared action? From our point of view at the Africa-Europe Foundation, we are ready to contribute to this effort. Thank you very much.
Thank you very much, Casimiro. Thank you very much. And with the words of Casimiro, we are closing the session. And just a final message, properly strengthen this collaboration between Europe and Africa. We are waiting every one of you to the 5th One Health conference that will be held in Sousse, Tunisia from October 28 to 30. We will soon launch the call for action, and we invite everyone that has joined today and authors to send their contribution and to gather with us in Sousse. Thank you very much to all the speakers, to all the panelists and the participants. And from Geneva, that's all. And let's close the meeting. Thank you very much.